All right, Dr. Nguyen here. I want to talk to you a little bit about the considerations I have during a full mouth extraction case like this. First things first, when I take a look at the panel, after RBAs are discussed in detail, patient elects full mouth extraction with immediate over immediate. We take a look at the panel, looking for any pathology. I don't see any pathological lesions that I should be concerned about besides periapical radiolucencies here. And now I want to discuss about how I would treatment plan this extraction and what I'm looking at. So I attempt to look at the big picture and then take a look at the little picture and take a look at the big picture again. The big picture is conical roots, first and foremost, for most of our molars, which is good. Number 19 may pose an issue. Number 30 may pose an issue. And then we take at the little issues. I go one by one through all the teeth. Looks like only teeth number 7 and 8 and 17 are missing. Tooth number 1 is present. So I would have to actually remove 2, then move distally to get access to 1. Tooth number 3 is giving me an issue as well because it's most likely going to fracture on me. 4 and 5 look okay. 6, longer root. And the bone doesn't have that much periodontal disease, so it's a little bit longer, so we have to take a little bit more time to hopefully preserve the buccal plate there. 7 and 8 not present, 9 and 10 present, 11 same issue, except we have a periapical radiolucency there as well, so it may be hard to numb that area. 12, 13 looks fine, 14 looks fine, 15 looks fine for the extraction, may fracture on us as well, 16 looks fine, 17 not present, 18, 19, that should be fine, 20, 21, 22, 23, 24, all the way to 29 looks fine, 30 may give us a little bit of issue, 31 and 32 looks fine, okay, and some clinicians may want a CBCT for 32. Patient didn't end up with paresthesia, but you still give the patient all the risks in terms of having paresthesia for the rest of his life or doing a coronectomy, root canal treatment, try to save that tooth. But overall, it worked out fine as long as you gave your patient all the risks, benefits, and alternatives there. So how are we going to go ahead and plan this? Now, here's a before and after photo. The immediate dentures steps have already taken place. So I go ahead and remove 2 first here to gain access to 1. So after this is removed, I go ahead and move distally with an incision with the scalpel to remove the root tip left in 1. Here we go. After that's done, tooth number 3, as you can see with the forceps here, I barely just put the forceps on and the entire thing snaps into my hand. So I actually have to dig for this for a little while, section it, and remove the mesial buccal first, then the palatal, and then I have to fish out the distal buccal root tip. Okay, so that one took a little bit longer than expected. So overall, how I managed to get this done in one sitting is I went ahead and got the upper right numb, and as I was finishing up with the upper right quadrant, I started getting the upper left numb. After I was getting the upper left done, after I'm done with that, I actually anesthetize the lower left side, and then I go back and suture the entire upper arch as the lower left is getting numb. So after I'm done suturing, and I didn't have to give any more anesthetic for the sutures for the upper arch, because if you time it correctly, you'll be able to get away with that. After we extract all the lower left, or almost done with the lower left, then I get the lower right numb, and then we can extract all of that as well. So that's the idea, and then we go ahead and suture the entire lower arch, which takes a little while as well, but hopefully you were able to get out the teeth in a timely manner. There, the extraction was a little bit too forceful. It came out a little bit more unpredictable as you can see. So I went ahead and slowed down the buccal lingual direction of the extraction so it can be extracted in a more controlled manner Fortunately, none of the root tips fractured off on that premolar. And that's pretty much it. I thank you for watching. If you'd like to have an open discussion with me about this case, I'm more than happy to. And feel free to enjoy the rest of the video. At the end, there's a little video of the patient talking with the denture in. And the video after where he's talking is actually 1 week after, and he's doing a good job eating and talking with it, so I'm pretty happy about that. All right, thank you very much. Good. Now, do you feel any numbness at all in your lower right? Your lower right?
No.
Down here. No pain on this side?
No.
Okay. Okay. And open? And then bite down? Okay. Are you enjoying your dentures right now?
Yeah, I eat on this side,
Okay.
but I don't know. It feel like
That side feels
I
better?
can bite this side.
Okay. Good. Good. Okay.